the stimulation by THC is important in pain. When we feel pain, pain is transmitted, it tells the brain, let's say I hurt myself here, it will go to the brain and the brain will say you feel pain, and the brain then will produce this compound, anandamide, which stimulates the receptor, and the pain slowly goes down. Now, it's not good for all types of pain, it's mostly for prolonged pain.
Oké, laatste AP alsjeblieft.
Ja?
Lekker. Wel, ja, toch het facet geveerd. Ja. Oké, stop maar. Dit is een mooie.
I'm an anesthesiologist, and the first place is I'm a transplantation anesthesiologist for liver transplantations.
Oké, AP.
Apart from that, I'm working 1 week in a month in the pain center here, especially for cancer pain. And this is what I'm treating. Yeah, well, cannabis is one of the many drugs we use for palliative care. We take all kinds of drugs that make their life easier, even illegal drugs. For instance, heroin in Holland is considered as a dangerous drug because it gives the patient euphoria. He comes in a good mood. But especially in the palliative care, we don't mind the patient is in a good mood, so I give them heroin. And compared to heroin, cannabis is a very small thing. It is a very safe drug, and the amounts of cannabis that we prescribe for these patients do not give a feeling of stonedness at all. We dose them in a dose that we expect medical effects. There's one new and very big reason that we apply cannabis, and it is its unexpected big role in the pain process in the body. We discovered in the last 10 years that we have endocannabinoids. In each body, even if you have never smoked a joint, is a certain amount of self-made cannabinoids. And they play a very important role in pain transmission. They regulate the way that pain comes to your brain. And so by using the receptors that your own cannabinoids use as well, you can influence pain. For instance, it's possible that somebody has good pain relief from morphine, but has nausea or has obstipation, so he should stop the morphine. If you give them a little bit of cannabinoids in some cases, like 20 micrograms per kilogram, which is a very small amount, you can diminish the amount of morphine that you're giving until half of the original amount. So they get less morphine but the same effect, but less side effects. And this is a new way that we are using cannabinoids.
Because pain is not one thing, there are many different types of pain. Cannabis was widely used in the 19th century against migraine. Queen Victoria had migraines. Apparently, her doctor gave her cannabis. At least this is what we understand from his papers. In the meantime, people, our group as well, found that THC does a few things, and these compounds in the brain, in the periphery, do the same. For example, appetite. Appetite is quite strongly potentiated by both THC and the compounds found in the brain, anandamide, for example.
For loss of appetite, yes, it is my first choice. This is a common knowledge that you, from smoking marijuana, you get a hunger kicks, like they call it. Each father or mother of adolescents who have smoked the whole evening expects the refrigerator to be empty next morning. Well, everybody knows that it stimulates appetite, and that's what it does. The patients who don't eat at all start eating again and start gaining weight.
Yeah. Medical marijuana on its own wouldn't have saved me. It looks like it has also an antiviral working, but you can't count on it to suppress the infection. But it made it possible for me to swallow these terrible pills with the terrible side effects all the time.
Probably the widest use of either THC or the compounds we produce in the brain, namely 2-AG and anandamide and so on, is in multiple sclerosis, which is also, in this respect, nerve damage. It has been shown, first of all, by just people that have multiple sclerosis, smoke cannabis and show that some of the symptoms are improved.
Most of them prefer to smoke, which is quite important, because if you smoke you also get the cannabidiol in your bloodstream, which is anxiolytic. That means that relieves you from fear and tension, so it has a function there.
Cannabidiol is a compound which is found in high concentrations in the plant. It also has some effect on multiple sclerosis. So all these things have to be investigated.
Two ways are the most used. One way is smoking it, so you have those typical water pipes. I don't know if that's the real word of it. And you can also order that at the same firm as we order the marijuana. And then they get a description how to smoke it. So then, but they have to smoke it with pipes. Well, you can make some joints, but you don't know how much you really use and how much is coming in. So if you use the pipe, then it's better. It works better. The second way to use it is to make tea. So you take 1 gram of this marijuana and then you take it in 1 liter of hot boiled water, fresh boiled water, and then you can cool it and then take 1 cup each time. But the taste of the tea is mostly quite bad. That's what it tastes not very well. So that's why you can also add some additives to it to make it better.
Yeah, there are side effects. Your eyes get red. That's one thing. The nauseousness goes away. It relaxes. That's, I think, probably the reason why it relaxes my stomach. It also gives you a dry mouth. You might get a little bit euphoric from it, but well, it's not that bad.
Well, if you use more, then it's the same as the first effect we know of marijuana, so that you can be a bit dizzy, that you have those very vivid dreams or something like that.
I said, yeah, listen, but marijuana, maybe when you take more, maybe it works better. Dus I gave her 1 drop on top of the road. She got high.
I went awfully slow and I couldn't really properly think.
1 draw away and it was okay.
I can cook again, I can cut meat again. Lots of little things I can do again.
You're likely to see more sunshine at the end of the tunnel than there really is. And that's not a bad case, because it also gives you a positive mind.